So now we are starting the session with Dr. Abhilesh Kumar Rao, right?
Abhilek sir, Abhilek sir.
Abhilek. Okay, sorry. Abhilek Kumar Rao. You are from Nepal, right?
Yes sir, yes sir.
Right. Now see, this is the probe over here. Can you see the probe?
Yes sir, yes sir.
Now tell me how to put the probe in a transverse section. I mean, is it like this or is it like this? Wait, I am putting probe like this or should I probe like this? How to put the probe? This way or that way?
This way sir.
This way. How can you say this way, not that way? How can you say this way, not that way? What will decide, this way or that way? Are you getting the point?
Yes sir.
What will decide the probe position? Whether I have to put it this way or other way? Please control your background noise. There is a lot of noise coming from your background. Move to a room where there will be no background noise.
Okay sir, okay sir, okay sir.
Okay. Hurry up, hurry up. Yeah, tell me. Again, the same question. Whether to put probe like this or like this. So this is the basic thing.
Yes sir.
Now see, if I am putting probe over here, again repeating the same question, whether to put this side or that side. Control your background noise. There should be no noise disturbance from your side. Dr. Abhilesh, I am waiting for your answer.
Yes sir, yes sir.
Do you know, yes or no? Tell me no if you don't know the answer.
No sir.
Okay, I will tell you. Now see, first of all, see over here, this is the uterus in cross section. Can you appreciate this?
Yes sir, yes sir.
This is the uterus in cross section. But the point is, I have put probe in transverse section like this. Whether to
Okay,
put
sir.
this way or that way, I will get back to that. But anyhow, I am putting the probe in transverse section just above the pubis symphysis, angling towards the inferior side. And see the resultant image. This is the uterus in cross section. Then, clear?
Yes sir, yes sir.
So this is the cross section of uterus, right?
Yes sir.
Now I am moving the probe in a clockwise, in a longitudinal section, and this is the resultant image. Done.
Yes
So
sir.
this is the longitudinal section of the uterus. Done. Now, again moving back to the transverse section. This is the transverse section. Then moving in a longitudinal section. This is the resultant image. This is fundus.
Yes,
This is
sir,
body.
yes.
This is cervix, and this is the vaginal stripe over here.
Yes sir.
Now to get the ovary, the right-sided ovary. Now see, I am now trying to get the right side ovary. See to my finger also. Right side
Okay,
ovary.
sir.
What I have to do, I have to slightly tilt the probe to the right side from the left side. So that the beam will be hit via the bladder. Then only you can see a good ovary. Clear? Yes or no?
Yes sir, yes sir.
So the point is, see to my hand. I am angling from the left side to the right side. Now see, from the left side to the right, so that the beam is hit through the bladder, and then I will see very clearly the ovary. That now to get the other ovary. Now see, this is the right ovary. To get the left ovary, where the probe has to be moved now? On the other side. It means that I will be angling the probe from the right side to get the left ovary. This is the left ovary over here. Then, so this is the technique to get the ovary. We will discuss with
Yes,
you
sir.
in great detail. Multiple patients. You control your background noise. There should be no background noise over there. Shall we say? Push. Complaint push. कब ऊपर पेट लाओ हेमा पेट लाओ dealer. Now coming back to the uterus. Now this is the uterus in transverse section. Later. Now see the question which I posed in the start. What was that? Manjeet, hold on. Now whether to put probe this way or other way like this, it will be decided by the marker which is over here. This is
Okay,
the
sir.
marker, which is the marker.
Yes, sir.
This marker should be towards the patient's right. Clear?
Yes, sir. Yes, sir. Yes, sir.
Okay. Now I'm
Yes, sir.
showing you on the monitor over here. This is the indicator. This is the depression. Now see over here. Can you see this? Say yes or no.
No, sir.
Can you see this indicator over here? The depression on the probe. I'm showing
Sir,
you.
I will only viewing the beads only, sir.
Sir. Wait. I will show you. No issue. Now tell me. Can you see this?
Yes, sir. Yes, sir.
Now this was the indicator which I was telling you about. Done?
Yes, sir.
So
Yes, sir.
this indicator has to be towards the patient's right.
Oh.
And right.
Okay,
Done?
sir. Okay, sir.
So
Okay.
it means that the probe position has to be like this, not other way.
Okay, sir.
So it means that when I will be putting onto the abdomen, I have to put it like this, not like this.
Okay, sir.
It
Okay.
means that this indicator has to be towards patient's right side. Clear?
Yes,
So
sir.
I
Yes,
have
sir.
to put the probe like this so that the indicator of the probe will be towards the patient's right. Done?
Yes, sir. Yes,
Now,
sir.
now the rotation from transverse section to longitudinal section is like this. Now, another question. If I am putting probe like this and this indicator is towards the right of the patient, this indicator should move upside. It is the clockwise rotation of the probe. It means
Ye-
that from transverse section, I have to take a clockwise rotation to get the longitudinal section. Clear?
Yes, sir.
It means this indicator will now face towards the head or towards the toe of the patient. Give me the answer. Will this indicator now go towards the patient's head or towards the patient's feet if I will rotate it clockwise? Now see here. Can you see the bed now?
Yes, sir. Yes, sir.
Now this is the transverse section, right? And
Yes,
in
sir.
this transverse section, this indicator is over here. It means
Yes, sir.
that this indicator is towards the patient's right. Done?
Yes, sir.
Now, when I am taking a longitudinal section, what I have to do? I have to rotate the probe. The point is where this indicator will go towards the head of the patient or towards the toe of the patient.
Head of the patient, sir.
Very good. Now this indicator will go towards the head of the patient. Clear?
Yes, sir.
So this is how we are taking the transverse sections and the longitudinal section. And this is the rotation of the probe from transverse to longitudinal section. Now see, I am showing you the probe. transverse, and this way will be the longitudinal section. Done?
Yes, sir.
Now, the point is, if I am putting probe over here in transverse section like this, whatever image I am seeing onto the ultrasound monitor, is this. Now see our monitor.
Yes, sir.
Can you see this?
Yes, sir. Yes, sir.
Now, question. This side is anterior, this side is posterior, this side is a right, and this side is the left of the patient. This is very important. This is screen orientation. This is already taken in machine settings, right?
Yes, sir. Yes, sir.
Now, again repeating, this is anterior, this is posterior, this is right, and this is the left. But the point is, when I am like this, see to my hand, when I am like this indicator, what I mean by like this indicator is towards the patient's right. Then only whatever I am showing on the screen will correlate. Are you getting the point?
Yes, sir.
Now the question is, if I am rotating this probe up, it means I am taking a longitudinal section. The image, whatever is seen, will be the longitudinal section. Now the question, for example, if the sake of argument, I will take this as a longitudinal section now. Is this anterior? Yes, this is anterior. This is posterior? Yes. Now, being in longitudinal section, is this right or is this left? Yes or no? Yes or no? Should I repeat the question?
Yes, sir.
What side is this? What side is this? If I am in longitudinal section, is this right? Is this left? I told you that this is right and this is left for transverse section. But for longitudinal section, what side is this and what side is this? Superior and inferior. It means that my right will be changed from from right to superior when I am switching from transverse to longitudinal section. Is this a bit clear to you? This should be more than clear because we have already taken this thing in the practical sessions. Okay, so what I will do, I am rotating from transverse to longitudinal. That way, what I am doing, I am now having superior and inferior. I don't have a right and a left. Clear? Yes or no?
Yes, sir.
It means that this is anterior, this is posterior, this is right, and this is left. But for transverse section, but for longitudinal, this will be standing anterior, this will be posterior, but this will not be right, this will be the superior, and this will be the posterior. Clear?
Yes, sir.
This is about the basic screen orientation, which we have already discussed with you in the machine settings. I will request you to go through the theoretical unless and until your theory will be more than clear, then only the practicals will be fruitful for you. Okay. So now
yes, sir.
we will take one more patient for your session.
Yes, sir.
Give the patient. So clear with this rotation of the probe, whether to
yes,
rotate
yes,
it clockwise or anti-clockwise. So the point here is that if you rotate clockwise, then the superior is here and inferior is here. But if you rotate it anti-clockwise, it will be the mirror picture of whatever is taught on Mr. Google and whatever the books are giving you. So I am leaving up to you whether to rotate it clockwise or anti-clockwise. But the point is, if you don't know that your superior and inferior are inverted, that is a reverse image, if you are rotating it anti-clockwise. Now, some of you may be comfortable with writing with left hand. Why I should force them to write with right hand? Now, I don't know whether you are lefty or you are a righty. on ultrasound, that will be decided by your rotation of the probe. Then,
Yes, sir.
so now quickly going through the patient. Dealer रखो पेट को. Wait, LMP. 3 normal. 3rd of November 2019. What is this? 3rd of November. I think that this all is there in the theoretical class. I will request you to go through the theoretical classes because these practical sessions are more for showing the patients. So we are not going to discuss whole of the theory over here. For theory, we are having the separate sessions, which is there on the website and on our platforms. Now see, this is the fetal head over here.
Yes, sir.
The axial section of the fetal head where we are taking the biparietal diameter. So this is about 31 weeks and 2 days. Is this breech or cephalic? Now see, I am putting probe over here. See where the probe is. And I am not getting the fetal head. This is the cervix over here, and this is the abdomen, and this is the femur. When I am moving up, I am seeing the fetal head over here. This means that this is the breech. Yes or no?
Yes, sir.
So this is the breech presentation, and in which plane I am right now? This is axial plane. In axial plane, I am having 3 sections. One section is transventricular, another is transthalamic. Okay, this is transthalamic right now. If I will move towards the occiput, I will get the cerebellum, that will be the transcerebellar scan. And of course, if I will cutting through the ventricles, that will be transventricular plane. So these are the 3 planes which is already discussed in the theoretical plane, these theoretical classes. So this is the abdominal circumference. So taking the ellipse tray to trace the AC. We are taking patients randomly, so you will get a variety of patients. So this is again showing you the breech presentation, and this is the femoral length over here. This is how we are measuring the femur. So the femur and the abdominal circumference along with the AC is corresponding to about 29 weeks, which is absolutely normal. And this is the fetal heart over here. How to trace the fetal heart? I told you that we have to take it on alternate basis. It means that you have to skip one and you have to set on the next one. So that way you will be calculating it on alternate basis. It is 155 for this patient. Now, where is the placenta? Dr. Ablesh will tell me where is the placenta. See, this is the abdominal circumference. This is the heart over here. This is the amniotic fluid. This is the placenta. Now, is this placenta anterior or placenta? And give me the grading of the placenta. Yes. Is this anterior or posterior placenta?
Anterior.
Anterior, very good. So this is the anterior placenta. Now give me the grading of the placenta, whether this is a grade 3rd. No, this is not grade 3rd because I am not seeing much of calcifications. This is grade 2nd. I will not even settle with the 2nd. This is about a grade 1st. Yes, it is grade 1st because the plate is not having deep indentations. But of course, we are having some lakes. These are the placental lakes over there, right?
Yes, sir.
A couple of placental lakes are accepted, but the question, if I see very prominent placental lakes, what the case can be? Recall your theory, which we have taken with you. If there are multiple placental lakes, like I see one placental lake over here, if I see bunch of placental lakes, one here, another here, third here. So if I see many placental lakes in a 30-week fetus, what that can be? For example, this is 30 weeks. If I see only one, I will be not worried. But if I see 10, 15 placental lakes, what that can be? Recall the theory. What that is, or what that can be rather. Yes, Dr. Lish?
Yes, sir.
What that case can be? Placenta accreta.
Yes, sir. Yes, sir.
So because in placental accreta, we are having a moth-eaten appearance, and if you see a bunch of this placental lakes, that can be placenta accreta. Then we have to put all efforts to rule out the placenta accreta. And the first thing is that we have to see retroplacental. We will not discuss the topic over here. We will show you multiple patients, but in between we'll be revising you what is taught to you in the theoretical class. So this is the myometrium, which is clearly seen over here. So this is not the accreta in this case. So this is the amniotic fluid over here. Then,
Yes, sir.
So this was all about this session. We will get back to you soon for the next session. Okay. So take care. Stay safe. We'll be soon taking the next session with you. We'll update you. Okay. Any comment or any
Okay,
question?
sir. Sir, how to calculate fetal weight, sir?
Fetal weight. Now see, for fetal weight, what I have to do, I have to give the head perimetry, HC, BPD, femur length, and abdominal circumference. This is here. BPD, HC, AC, femoral length. Then I have to go to the worksheet. And the machine is automatically giving me, now see, this is the thing, what I will show you. Wait. Hold on. Can you see this? This is BPD. This is HC.
Yes, sir.
This is AC. This is FL. So I have to give BPD. I have to measure the BPD. I have to measure the HC. And whenever I am measuring all AC, FL, BPD, and SC, then machine will automatically calculate the fetal weight. How? This is the worksheet over here. Can you see? Then what I will do, I will go to the worksheet. Now see, I'm going to the worksheet. And over here is the chart. This is the chart. Wait, I will show you. Can you see the chart?
Yes, sir.
And over here is the calculations. EFW is the fetal weight, and for this is 1,189 grams. You don't have to calculate the weight. Machine will calculate it. But the point is you have to give BPD, HC, AC, and FL to the machine, and machine will automatically calculate the weight as per perimetry. But if you will not give, you will not take the BPD, you will not take the HC, you will only take AC, maybe only FL, then machine will not be able to calculate, and hence machine will not give you the fetal weight. Clear?
Yes, sir. Yes,
Okay.
sir.
Anything else?
Yes, sir.
Anything else?
No, sir.
Okay. Thank you. See you soon. We'll update you regarding the next session.
Okay, okay, sir.
Okay. Bye-bye.
Bye, sir.